struggle I had as a medical student would be trying to, because I was living in a flat with other university students. The struggle I had was really after your study in library, come back home, trying to cook meals, trying to clean your laundry, do all the self-care things. And I guess in the weekends you'll be studying, and while the other, your friends from other faculties, they will be going out, hang out and have fun. I think to me, the struggle is trying to balance between study and relaxation, knowing when you need to relax, because if you don't know how to relax and you work so hard, by the time you're a doctor, it's even harder for you to learn how to relax, learn how to do things outside medicine.
Right. And I think in your case it's a bit more challenging because you're staying away from home.
Yeah.
Right. Kenneth, how about yourself, being totally locally trained and brought up?
Well, I think the challenge for medical school training in Singapore is that number one, I'm a very technical person. So I know from when I was secondary school, JC, I love all the details. So in medical school, I was spending a lot of time reading the textbooks, trying to understand the little details about biology, pharmacology, anatomy. And you realize that some of those details may not be actually relevant to clinical practice. And it's more important to actually have like a broad-based understanding and exploration of all the various subspecialties and specialties. And so I felt that my approach was wrong at the start. The second part was also I felt that it was difficult to balance between your personal time and your studies, and so that also took a little bit of effort to get used to.
So it's a bit of like medicine is an art and not a science, right?
That's right.
Yeah, so realizing from your technical approach to medicine.
Because you can spend a lot of time deep diving into one particular area, but you may not end up being a specialist in that area. And when they test you on the exam, it may not, be at that level of depth. Right. So there's a lot of extra effort.
Right. Yeah. For personally, I find that it's kind of like a nerdy kind of traits, right? So I believe you probably have thought of it as well. I think all of us have certain liking or affinity to reading. We don't mind reading things. We don't mind studying. We don't mind taking exams. Maybe you do, I don't know.
I do mind actually.
I love taking exams,
really?
To be frank. Yeah, I have a different mindset about that. So in my mind, it's like, since I'm studying so hard, right, I need to show the world that I've done it. The only way to show it is to take the exam, right, to pass it. If you don't pass the exam or do well in the exam, then what's there to show? All the hard work goes to nothing. Yeah. So I think it's like sounded like a cliche, especially in Singapore. Doctors need to have the attitude of lifelong learning. Actually, for that matter, it's not only doctors, everyone nowadays, but doctors in particular. So the moment that you think you have arrived, I think is the end of your career. Right? Do we think so? Right. Yeah.
But that's the annoying part about medicine as well. So because things are always changing, just because you finish reading the textbook doesn't mean that the textbook won't change the next year.
Yes.
And the guidelines will also change the next year.
That's right.
So it's actually continuous work.
Yes, correct, it is.